Hello everyone, I'm Anthony Bowe, and I have been following my mentor, Dr. Barrett, for the past semester, and today I'll be presenting the research that I've been doing throughout my mentorship about surgery in space. So let's get right into it. So space adds a lot of complications to medicine in general. So here are some of the complications that just being in space adds, not necessarily the microgravity. So in the space station, there's a closed system, so you have to watch out for gaseous anesthesia because it might poison the air supply, and you might have to use a different type of anesthesia. Also, if you're ventilating somebody in space with pure oxygen, the oxygen levels in the room might build up and increase the risk for an explosion, so you gotta watch out for that. Communication delay. Usually in space, there won't always be an expert on every medical condition that gets brought up, so you might have to talk to the ground, and as we get further and further away from Earth, communication delay will expand. But right now, it's not that big of a deal. Also, if you don't have what you need right away, it takes a while to get stuff from the ground into orbit. And usually with your crewmates, you're emotionally connected to them. On the ground, we don't usually let doctors work on their patient, on their family members or friends, because it can affect the decisions they make. Also, there's a lot of acceleration forces in space because you have to get up there. And limited crew resources. Not everybody's an expert on everything, and it depends on who you have in orbit for medical expertise. And diagnostics change in space due to changes in fluid physics and all sorts of physiological changes. Here are the complications of just being in zero gravity. So the fluid physics change, so blood spurt would be different. It also pools differently. It doesn't pool. The surface tension makes it run up and down the arteries, so it would be completely different. IV fluids wouldn't work the same. You need a different type of IV bag to get fluids into somebody. Also, keeping track of your tools would be very difficult because they float around, so you need a system to keep track of everything. Your anatomy shifts when you go into space, so organs that might have been in the abdomen previously might move up into the chest cavity, and your common landmarks that you've been using on the ground won't work in space. Also, floating contaminants like dust can get into your area of work. And also, most people haven't practiced a lot of medicine in zero gravity, so it will be uncomfortable. Okay, here are the physiological effects that space adds to the body. So pretty much immediately all these things start taking place. Some take longer than others to fully adapt. I'll have a chart that shows how long it takes the body to adapt to the different systems. Bone and muscle loss due to you're not standing, gravity isn't pushing on you, making your bones and muscles work. Anatomical shift, as I said. Because of the bone loss, your body dumps the extra calcium into the bloodstream, so hypercalcemia. Changes in your vestibular system. Most people experience nausea when they first get into orbit, and they can take drugs to counteract that, and it usually goes away after maybe a week or two. Also, heart atrophy is not necessarily due to the zero gravity, or it's just due because you're not working as hard. You don't do as much cardio when you're in space, unless you need to work on it with the bike or the treadmill. Increased exposure to radiation, which can cause long-term effects like cancer. And then the fluid shift, which is a big problem because the intracranial pressure, the pressure in the brain increases and puts pressure on the optic nerve, and it can cause vision problems, which can be corrected using corrective lenses. And a decrease in blood volume because the fluid shifts upward and takes up more volume. Not necessarily, but it just causes the body to get rid of the excess fluid. Here's what happens when the intracranial pressure the brain pushes on the optic nerve, causing it to bend, and your vision may experience changes. Here's the physiological response. Everything takes around 1.5 months to fully adapt to being in zero gravity. Of course, your vestibular system will immediately be noticed. You'll probably feel nauseous. And this clinical horizon line is basically what you would notice while you're in the body, while you're in your own body. Most of these changes you won't notice, but stuff like fluid shifts and your cardiovascular system, you might feel your heart beating differently. Okay. Most of the problems that space does cause to body, we can counteract through countermeasures. To prevent the bone and muscle loss, we do load-bearing exercise with the ARED. It's like a all-purpose machine. You can convert it to do squat, bench, basically all load-bearing exercises. And then to work on cardio to keep your heart healthy, you can use the treadmill or the bike. It also puts pressure on your bones, the treadmill does. To counteract hypercalcemia, and which eventually could lead to kidney stones, you can take biphosphonates and potassium citrate, which can help dissolve, like forming kidney stones. Prior to going to the ground, because being in space causes you to lose blood volume, most astronauts before landing will drink saline to get their blood volume up. And once they get on the ground, they'll take IV fluids to make sure that they get their blood volume up. Nausea medication can counteract the vestibular changes. And if you do experience urinary retention, catheterization can be a treatment for this. And corrective lenses for the optic nerve. Here's the treadmill. That's me on the treadmill. It has straps to pull you down because there's no gravity. Okay, so how do you decide what you bring into space? The 4 main concepts, 5 actually, that are thought about when bringing something into space is how much it weighs, how much fuel it's going to take to get up into orbit, how much space it takes up, and how long it's going to last in orbit, and also how expensive it is. Risk analysis can be used to help. All these factors are used, and something that is more likely to happen or is more necessary to prepare for will sacrifice less important things. And even if it takes up a lot of space, but it's very necessary to be on board, they'll make room for it. And also, you have to think about, you don't want to bring anything into space that nobody knows how to use, so you want to bring something that that is easy to train and can be used, because they don't want wasted space. The current medical capabilities in space are pretty much everything you could find at your local doctor's office, probably a little bit more. Here is the medical restraint table. It's grounded because if you use the defibrillator in space, it could cause a shock to go through the station, and it could also lead to an explosion if oxygen levels are higher due to the ventilator use. They have centrifuges to analyze blood. You can have an eye exam, and doctors on the ground analyze the changes in the eye. You can draw blood, as Dr. Barrett. Ultrasound. And here's a diagnostic kit or a standard medical kit. There's stethoscope, hot cold pack. Basically, they have multiple types of kits, color coded. So there's an emergency first aid kit that's red, and this one is more like diagnostic things that aren't as important to need right away. CPR is a little bit different in space since there's no gravity. There's drawbacks. because you have to relearn how to do it, but it's a lot easier. It doesn't take as much out of you to do CPR. You can almost do CPR forever because you're just using your legs to push off the roof, wall, whatever it is at that point. Just you need external force pushing on you so that you can get the right depth on the CPR stroke. Okay, so most surgical conditions in space don't happen very often, but these are some of the conditions that NASA has deemed as possible to occur in space, or something that we need to prepare for. So abdominal injury, abnormal uterine bleeding, acute cholecystitis, biliary colic, acute compartment syndrome, which can occur if you have like scar tissue and it cuts off blood flow, and then your arm can swell up, and it's not very good. And you need to debride the wound. You need to do surgery in order to fix it. Acute pancreatitis, appendicitis, which is heavily debated. I'll get to that. Burns, chest injury, choking due to stuff floating around that you might not notice, or just eating. Chest injury, I already said that. Eye penetration due to foreign objects floating around, and head injury. Also, landing loads, because the Soyuz that we have right now is not very comfortable, so that can cause injury. Nephrolithiasis, which is basically kidney stones. Just skin abrasions, lacerations, and a small bowel obstruction, which is a complication of an appendectomy, which also needs surgery to treat. Urinary retention, and general wounds. So here's the appendectomy debate that is highly debated in the space medicine community and emergency medicine, or extreme medicine community. A lot of people argue that you should prophylactically remove your appendix, which remove it before you get appendicitis, in order to prevent it happening randomly in the field, and you can't do anything about it because you're a long way from home. But what most people don't realize is appendicitis, or an appendectomy isn't a complication-free surgery. Most doctors think it is because they do hundreds of them a year and nothing much happens. But the scar tissue that reforms after appendectomy can sometimes cause a small bowel obstruction, which is just as dangerous, and which is more likely, we don't know. That's why there's a debate.
So I have a question for you, like an audience would ask you, is that done in any other venue?
Yes. The Australians,
Those are ours.
they require that you remove your appendix before traveling to Antarctica.
Or that somebody removes it for you.
Yeah, somebody removes it for you.
Well, that's an important clarification because somebody did remove their own in Antarctica. So.
Okay, so
They were Russian, of course.
They were.
as of yet, most likely, if you had a surgical problem in space, we would try everything before doing surgery on the space station. So we don't have a space ambulance right now. It's just the Soyuz. It's not a great ambulance. The space shuttle would have been better, but it would be a theoretical space ambulance would be well equipped to bring astronauts home. You would have medical monitoring systems, life support, and trained astronauts on board for dealing with patients who are injured. It would have a gentler reentry path. The Soyuz, you experience high G loads on reentry, and the landing isn't that great because it feels like a car accident. That's how it's been described. The Sierra Nevada Dream Chaser is what has been described as a the G forces. The G x-axis is the most favorable because the GZ throws blood from your head to your feet, and that causes you to pass out, whereas the GX is more tolerable. You can take more Gs through your chest, and a spaceship like this would allow you to take G's through your chest if you're laying on your back instead of the Soyuz, which can apply GC forces and GX. Also, patients when they're healthy, or people when they're healthy, aren't in great shape when they're coming home. So you would most likely want to make sure the person is absolutely stable before transporting them home, because even if you're healthy, you're not in great shape, as you can see, and it's not a great environment in the middle of Baikonur. And the landing with the Soyuz rarely lands on the bottom, so you get tumbled around a lot, and it takes a while for people to find you. So you want to make sure that the patient is stable before bringing them home. Surgery in microgravity. It's been tested, like surgery examples or models. Analogs have been tested on the zero-G aircraft, like the Vomit Comet, as you can see in this picture. Also, they've done some dissections in flight, which can act as an analog for human surgery, but no surgery has actually been done in space.
Dissections of what?
Mouse. So for a long distance and long duration exploration mission, you'd most likely need a surgical suite or an area that you could transform into a sterile area that was prepared for surgery. You would need a lot more preparation and a higher level medical training for a long duration flight, because there's no way to go back home. So you would need the person who's most experienced there. And you would need a lot of independence from the ground, because as you get further away from Earth, the comm delay becomes, you can't work through it, because you need instant answers. If you cut an artery and you're like, what do I do? It'll take 8 minutes for them to get back to you, and then they're dead. So you need to be independent from the ground. And it's also impossible to resupply, so you would need to have everything you need there, or it would be a long time to resupply, depending on where you are. This is, it would probably be a little bit bigger than this, but an idea of what a surgical suite might look like. You might use a glove box to keep blood and other contaminants contained from contaminating the rest of the vehicle. The patient table / chair, this is the neutral body position. This is the position the body assumes when you're in space. And it would be favorable to have a chair that kept somebody in this position instead of forcing them to lay flat. It's been proposed that you could do telerobotic surgery or robotic surgery in general, but robots weigh a lot and they're expensive, but the surgery would be done by somebody on the ground, most likely, and that would deal with the expertise thing. You wouldn't have to have an expert on board. It would require less training for astronauts because they wouldn't have to know how to do surgery, but also added training because they would have to fix the robot if it broke. So there's trade-offs. And also, it wouldn't, with the trade space thing that I brought up with the mass, power, volume, it most likely wouldn't get used that often because people don't have surgical issues, as we haven't seen any necessarily urgent surgical issues as of yet in the space program. So I don't know how often the robotic surgery would be used, but it might be necessary on a long duration flight. Another option is just-in-time training. So basically, they would send their problem to the ground, and the ground would either walk them through audio, or they would send video tutorials or an article just explaining on how to do the surgery, and they would learn how to do it and then do it instead of preparing for every possible thing. This would be similar to how on Apollo 13, when their carbon dioxide scrubbers broke, how they walked them through how to build one. But it would be surgery, not making carbon dioxide. The reality of surgery in space. It would be pretty high stress environment because these are your crewmates. What happens if they die? You're nervous, you don't know what to do. You're not an expert, you're in an unfamiliar environment, you're a long way from home. You're already under a lot of stress, but we would do, an astronaut would do what needs to be done. It's just, it would have an effect on their performance in surgery. The outlook for surgery in space, as of right now, we don't need the capability to have advanced surgical procedures done in space. But as higher capabilities come out and we can go further and further into space towards Mars, the moon, back to the moon, we will most likely need to have advanced surgical capability in space. And any questions?
I have a question.
Yeah.
On the